Moving now on to cervical flexion syndrome, you're going to see a little bit of a pattern here. Again, support the upper extremities, especially if they're contributing to any scapular movement impairment syndromes with down rotation, depression, whatever they might present if it's implicating an issue in the neck. These patients, I know it seems unnatural, but we do want to encourage a slouched or slumped posture in order to improve cervical lordosis and thoracic kyphosis, because these patients often will almost present with that military stiff neck type presentation, wanting perfect posture. So here we actually do want to encourage a little bit of abnormal posture. We want to limit cervical flexion throughout the day and at night. And I put it nights because a lot of times we'll see that the patient likes to sleep with their head propped up a good amount into flexion, and over time that just further irritates the issue. And then we have a couple exercises here that we'll focus on specifically for cervical flexion extensions or flexion syndrome. You want to work on, in prone, moving the cervical spine into active extension. And we want to encourage extension throughout the entire range, definitely in the upper part as well, because they are so fixated on trying to maintain an upper cervical flexion. So encourage a patient in that position to move into extension instead. And then in the quadruped position, we'll have the patient perform cervical flexion extension, that middle third of the range of motion. Again, trying to break up that locked mid to upper cervical alignment and encourage a more natural segmental cervical extension starting at the top and working its way down.